Welcome to the Boise Metro Chamber's CEO Speaker Series. Please find your seat and begin eating. The program will start shortly. Ladies and gentlemen, please welcome to the stage Chamber Board Chair and partner at Holly Troxel, Tom Martell.
Welcome today to the Boise Metro Chamber CEO Speaker Series. We're excited to have Charlene Maher, President and CEO of Blue Cross of Idaho, here with us today. The main purpose of the Chamber CEO Speaker Series is for members of the community to hear and learn from the top CEOs in Idaho who are having an impact on Idaho's business. Today's luncheon is being presented by the Bank of America. Our sponsors today are the Boise Airport, United Heritage Insurance, Idaho Business Review, Blue Cross of Idaho, Holland and Hart, and Alaska Airlines. The table sponsors for today's events are listed in your program. Please join me in thanking all of our sponsors today. I would now like to introduce the reserve table. Please stand and remain standing as you're announced. For the audience, please hold your applause until I've announced everyone. Charlene Maher, President and CEO of Blue Cross of Idaho. Lauren McLean, Mayor of the City of Boise. And Bill Connors, President and CEO of the Boise Metro Chamber. Please join me in welcoming our reserve table. I would like to now take the opportunity to introduce Charlene Maher. Blue Cross of Idaho and the Blue Cross of Idaho Board of Directors selected Charlene to serve as the new President and Chief Executive Officer of the organization, and she began her service at Blue Cross in March of 2016. Charlene, prior to that, was the Chief Marketing Officer and Senior Vice President for Commercial Sales at Emblem Health in New York. Charlene brings 30 years of health insurance experience to Blue Cross of Idaho, including strategic planning and execution, new business development, operations, sales, and marketing. During her time with Emblem Health in New York, she was responsible for the profit and loss of the commercial market segment that covers more than 3 million lives and $8 billion in revenue. From my perspective, Charlene's accomplishments since she's been in Idaho are similar to what she did in New York. Prior to working at Emblem Health, Charlene worked for Medica Health Plans, Inc. in Minneapolis, Minnesota, where she provided executive responsibility for the individual and family managed healthcare business in 4 states. She also spent 15 years with WellPoint, Inc., where she rose to the position of Vice President and General Manager for Individual Services for 14 Blue Cross Blue Shield states. In this capacity, she had divisional profit and loss responsibility for more than $5.4 billion in revenue and 2.1 million lives. Charlene began her career as a registered nurse after receiving her Bachelor of Science in Nursing from the University of Texas. I know that when I first heard Charlene speak when she came to Idaho, I was very impressed with the idea that she'd come up through the rank and file of insurance companies and had the perspective of everybody within the company and how blessed Blue Cross is to have her. So with that, I introduce our speaker for today, Charlene Maher.
I'm a walker, so I can't stand behind a mic. I probably should have paid attention to Tom's presentation because he basically gave my entire presentation. And so some of this is going to sound a little repetitive. But hello, I am Charlene Maher, President and CEO of Blue Cross of Idaho, and the outgoing president of the Boise Metro Chamber, which means I taught Tom everything he knows. So he did a phenomenal job. Let me start a little bit with my history, and Tom really spoke about this. And I think it's important because you'll hear a thread of this beginning throughout my entire career. The most important person, the most important hero the most important leadership mentor for me was my mother. And I've shared this with many people. My mother, her mother never spoke English. She came from Ireland. She spoke Gaelic. My mother was the oldest daughter of 8 children. She had to quit school to stay home and help her mom, who couldn't speak English. And she believed there was nothing more important than education. Nothing. She wasn't allowed to go to school because she was a female. I'll just let that hang for a minute. And then later on, once she was married, she was still not allowed to go to school because she was a female. And she needed to stay home and raise the children. All she ever wanted to be was a nurse. And back in the day, the hospitals would have diploma programs for nurses. So my mother became a nurse. My father actually worked in the hospital in procurement. So I guess I've been in healthcare my entire life. My mother used to, believe it or not, true story, she used to hold up that Blue Cross Blue Shield card and tell me it was her most important asset. Now, please know, as a teenager, I thought my mom was nuts. And how could a Blue Cross Blue Shield ID card be her most important asset? And as a child, I guess, I don't know, maybe that influenced me. But my mom wanted me to become a nurse. And I swore to my mother that I was never going to become a nurse. So then when I graduated nursing school, I worked in critical care. I specialized in the bypass units down in Texas in the Heart Institute. A phenomenal career. You learn about leadership, you learn about autonomy, you learn how to assess issues quickly. Of course, most clinicians will tell you if they leave the industry, it's because they hurt themselves. So of course I hurt myself, bad back, had to do something else, tried going back to the hospital. After 2 weeks, back on the floor with a back injury. Try again, 2 weeks later, back on the floor with a back injury. I came off of work one day, green hospital scrubs, my Reebok sneakers, which that had been my clothes for many, many years. Quite glamorous, actually. And I called Blue Cross of California. And I said, I don't know what you do over there, but do you hire nurses? And they said, come on in for an interview. And I said, I have 2 problems. One, I have no clothes. I have green scrubs and Reebok sneakers. And 2, I don't have a resume. I've never had a resume. I came out of school. I went into my training as a nurse, and that was the end of it. They said, come on in anyway. So I went. Who knew, right? So they said, can you multitask? I said, I have 3 kids. They said, you're hired. And so that's how I ended up in the insurance industry. I was paid $10 an hour. I sat in a 4x4 cube. They told me they would train me. I've never gotten training yet, so I apologize for this speech. But I had to self-teach. And I started with medical underwriting and medical policies, and then I did medical review, looking at claims. Then I did utilization management, and I did case management, and I did care coordination. And I wrote policies and procedures for every one of the clinical roles in the organization. And then I worked in business development, product development, mergers and acquisitions, marketing, you name it, I did it. And the reason is, and I say this all the time to my people, number 10 on the job description said other duties as assigned. Love that line, because that meant I was not stuck in that 4x4 cube doing the same production work every single day. I could take on any opportunity I wanted, and I could zigzag through the company. And that's what I did. I learned every single job of that organization. I worked in legal on litigation reviews. I worked in finance for underwriting, whether it was medical underwriting for individual, small group, large group. I did products. I did national training. Mergers and acquisitions. They never let me work in HR, though. I think there's a reason for that. But, so how did I end up in Idaho? I've worked in 20 states. I've lived in 10. I said I was done. I built a house, a great townhouse on the beaches of South Carolina. And I received a phone call from someone, a recruiter that I had known for 15 years. And not because she had ever found a job for me, but because I worked in 20 states. So I knew someone for every job in every role across the entire United States. She calls up and she knows me so well, she knew she could poke me. She said, "Are you ready to do it for yourself and to stop doing it for the men?" I'm building a house. So I said, no, I don't want to be a CEO. All they do is give speeches and hang out in political offices. I mean, who wants to do that, right? And I'm a great number two. Give me the operations, I will clean it up, I will make it great, but no, I don't want to give speeches. I'm not going to do that. So anyway, she put my name in the hat. And I came out to interview with an incredible group of people. And it was such an easy interview. You know when you're so absolutely calm because you don't want the job. You know, you're not moving to Iowa because, believe it or not, up until a couple of years ago, everybody thought Idaho was in Iowa. But I didn't want the job, and I never wanted to be a CEO. So it was so easy to have this interview. And these people, this board of directors, they are all Idahoans. They are passionate about Idaho. They never one time talked about Wall Street, investor relations, money, the financials. What they talked about is, can you make our company bigger, bolder, better? Can you innovate? Can you change the healthcare ecosystem for Idaho? Can you do great things for the people of Idaho? If we empower you, how much can you do? So my husband and I I've been in this house 45 days now. We spent time in the community. We went to, believe it or not, the parks. We went to restaurants. We just drove around looking at the communities. My husband walked the blue field because every man in the US wants to know if the blue field is real. But anyway, that was exciting for him. But what was different about Idaho is people of Idaho want to know who you are. And they want to know why you're here. And they want to know what you're going to do when you're here. But more importantly, they want to know how they can help you. Did I say I've been in 20 states and lived in 10? Idaho is different. Everybody says that, but Idaho is different. The people, the community, the work ethic, the compassion, the desire to be bigger and better, the intellect, better. Better. And I was moving from Manhattan at the time, so better. Culturally similar to Manhattan, it was fine. And so my husband and I were sitting there, and it's this moment where you have to ask yourself, do I want to do this? And if not me, who? Who is a better person to do this, to answer the questions of this board, to be with these people, to lead a new company or an old company in a new way of thinking, to change the culture? Can I make the healthcare ecosystem better? Am I ready to serve? So I think I packed up 2 suitcases and showed up in Idaho. And my husband said, we just built this house, we're not moving. It was 45 days we had that house, and it was a great Christmas house one year. And so that's how I ended up in Idaho. So now let's go into Blue Cross. Blue Cross has been in Idaho, founded by Idahoans for group health insurance. Employees paid $1 a month to have health insurance. It's been here 75 years with a mission of only serving Idahoans. We are the state's largest insurer. We're the only health insurance that is completely housed and controlled and led in Idaho. Idahoans serving Idahoans. These are our neighbors, these are our friends, this is our family. We pay over $6 billion in claims every year. We pay 9.5 million claims, and we answer over 600 phone calls. That's just for medical. That doesn't include dental, that doesn't include pharmacy. That's only medical. We are a tax-paying mutual insurance company, not for profit. People often get confused when they think not for profit that we don't pay taxes. We pay a lot of state and federal taxes. But the mutual part is important because it means we are structured and built to serve the mutual needs of the people of Idaho. That's it, the mutual interests. That is what we are required to do. We are legislated to hold money in our reserves for three main reasons. And we talk about these three reasons all the time, and everybody kind of looks at us like, well, that's ridiculous. But one is claims. We have to be able to pay the claims. And it's not just pay our claims. We have to pay the claims if every other carrier left. We're carrier of last resort. We are Idaho. We're never going anywhere else. We will be here if everybody else decided to leave. The second one is tools and technology and things that help healthcare system. The third, which everybody always scoffed at, was in case there's a pandemic, we have to have money to protect and preserve the people of Idaho. And I have said that for 30 years, and people would look at me and go, well, suddenly it's more important than it used to be. We currently have over 1,400 full-time employees, with temps and contractors, 1,800. We have 6 offices throughout the state. We're from Coeur d'Alene to Pocatello. We are the leading, best insurance company, I would say in the nation, but we'll say in Idaho. Blue Cross has always been focused on dedication. We don't serve Wall Street. We don't serve an out-of-state corporate office. We don't serve an out-of-state board of directors. They're all Idahoans. This is personal. We serve Main Street and we serve your street. Our employees actually do know Grangeville versus. I actually went to the truck stop not too long ago. So now, Idaho's not a secret anymore. They've left Iowa, they're coming here. But what that means is national health insurance companies are also paying attention. And so when I say I've worked in 20 states and I've worked at not-for-profit and for-profit, this is personal to me. Because when I ran a very large state, I had 1 million individual members, just 1 million individual members. It was a dividend call by the corporate office that was across the nation, and they were going to go into investor relations and serve Wall Street. And I had to send a check of hundreds of millions of dollars across the nation because it was a dividend call. It personally offends me when the premiums paid by the people in a state are not invested in that state, that they go to a corporate office somewhere else and or they go to Wall Street. That is something I will fight every single day because the money in Idaho, we're not a rich state. We're 48th, 49th FPL, federal poverty level. We need the money here. And this is something that is so personal to me that I swore I would never work for a for-profit. I would only work for a state and a not-for-profit, and frankly, a board that believed in that mission, because that's real. We are here for the long run because we live here. We invest here. We are carrier of last resort. We will never leave you. We will never leave you. So what does that commitment actually mean, and what does it look like? So now let's talk about the pandemic. Our commitment to this state was very clear during COVID. It was clear before, but we're pretty quiet about the things that we do. But when COVID hit, so many needed help, and we immediately engaged. Do you know, for our members, approved COVID testing and treatment was paid with no cost to any of our members. We expanded telehealth, which was not easy. We had to get the legislators to work with us to give us the permission. We had to change the laws to help us expand telehealth. $77 million is what we have paid out to serve the people of Idaho just for COVID testing and treatment. In addition to that, our customers, we wanted to make sure our small business leaders and our small business customers would be there when this was over. We immediately got on the phone and called them all. What do you need from us? Do you need more time to pay your premium? What do you need? And it's amazing, the people of Idaho and the businesses of Idaho, yeah, we don't really need anything. They're so proud. They're going to power through. We reduced premiums for our fully insured groups by $11 million because even though they said they didn't need the help and they didn't want the help, we knew the help was ours to give, and we did it. Providers, we were the first company in the nation, the first insurance company in the nation to reach out to our independent providers. These are small business owners, very small margins that they're running these businesses. We wanted to make sure every single doctor that did business in Idaho was there when this was over. We continued to pay what we had paid their typical run rate. We fronted about $1.5 million to individual independent physicians so those businesses would be open for business when this pandemic was over. We need to support each other. That's what Idaho does. From a legal regulatory, we sat on the governor's Economic Recovery Council. We advised him of what would matter. We participated and consulted with the Department of Insurance, with the Department of Health and Welfare, with CMS, with HHS. I went to Washington, D.C. and consulted with Alex Azar on behalf of Idaho and was fortunate enough to go into the war room. And imagine a war room where there's kind of a large rectangle and TV monitors on 3 of the 4 walls. One had every news channel, one had where all the cruise ships were, where the planes were, what the US stockpile of equipment and testing supplies was. And then on the other was a map of every state, a US map and then every state of pink to red. Where was it exploding and where did they need to be? They knew exactly what was going on every minute of the day. They really did have a plan. We partnered with the World Health Executive Forum. We are the only Blue Cross insurance company to partner with the World Health Executive Forum. What that is every CEO that's running the national hospital system in the UK, Austria, Switzerland, Sweden, Canada, Australia, New Zealand, Italy, because we wanted to know what was happening there. Because what was happening in Europe was coming to the East Coast, was coming to the West Coast, and then slowly coming to Idaho. But we were watching it from Italy across, and we were getting best practices, and we knew what to do, and we knew how to help, and that's where we spent all of our time. We reach beyond our members, because when you talk about a mission and you talk about serving a community, it's not just who our customers are. It's our neighbors, our friends, our family. We immediately dispensed about $500,000. COVID Response and Recovery Fund, the Idaho Business for Education to make sure the children had laptops, Idaho Food Bank, make sure people had food, obviously. We emptied our kitchens in our facilities and provided that. We called our hospital partners and said, do you want our toilet paper? I mean, who knew that would be an important asset at the time, but we were willing to do that. Since then, we've purchased a mobile vaccine van for St. Al's because we need to go out to the rural communities and we need to make sure that people have access to get a vaccine. They're not always going to come here. But giving is part of our DNA. It goes back to our mission. Blue Cross of Idaho, the employees of Blue Cross of Idaho, and the Blue Cross of Idaho Foundation give millions of dollars. We support the YMCA Thrive Center, the creation of that building. Does anyone know what the Thrive Center is? So imagine a 35-year-old, 6'4" military soldier dressed in his uniform, crying because he does not know how to take care of his son. I don't know how to be a father to my son. My son has autism. My son is on the spectrum. My son can't go out in public. My family is exhausted and we don't have a safe place to be or to go, and I don't know how to help him. Well, that's what the Thrive Center is. Not covered by insurance, so we gave them the money to build this center, because when you talk about inclusion, I mean, we've got this, everybody's talking diversity, equity, inclusion. Inclusion means you go to the people and you help them and you learn what they need and you meet them in the middle. It's not expecting these children with autism to come to you. It's expecting you to give them the tools so they can meet you halfway, and then you go the other half. Thrive Center, it's an amazing facility. You should go see it. It's in Meridian. Camp Rainbow Gold, they lost their property in Ketchum. Camp Rainbow Gold, who would kick the kids out? But we had to find, they found new property, and we're helping them build a medical center. These are the kids that are suffering with cancer and their families. They want to have a place for the kids to go. Camp Rainbow Gold, Women and Children's Alliance. By April of last year, the calls into that center went up 194% over the year prior. That is a crisis, and no one can take care of that alone. We needed to be there. The Wasmith Center for Human Rights, the Ronald McDonald House, there's 100 others. I can name the Idaho Youth Ranch. People often ask me, how do we lower healthcare costs? It's an obvious question. Research will tell you one of the #1 factors we can do to lower healthcare costs is education. Education, it's critical. When we talk about our workforce, when we talk about leadership, when we talk about our future, we must recognize that our young are depending on us to give them the tools so that they can advance their lives, they can advance Idaho, and frankly, they can take care of us a little bit, I don't know. But anyway, I had the privilege a few years ago of being invited to Jim Everett and Doug Brigham's office. And it was just a meet and greet. I hadn't been out to College of Idaho. In fact, I think that was my second time to go to Caldwell. And we're sitting there, and I asked about scholarships. And the reason I asked is that Jim ran in, he was out talking to people about trying to get money for scholarships. And I said, well, how much is a scholarship? What's a 1 year? And he said $37,000. And you do this all the time? And you do this every year? You start over again and do this every year? Yes, and so he's explaining this process to me, and I don't know if I'm lazy or what it is. And I said, how about we just give you two, you know what, we'll give you a scholarship. No, we'll make it 2, right, Jim? And, but let's do it for 10 years, because I don't want to have this conversation every year. I mean, Jim, I like you. And Jim and Doug said, well, we'll come out to your office, we'll sit down, we'll talk about what we need to do. And I said, yeah, no, you don't have to do that. Well, 2 scholarships, 10 years, we're good. And Jim's like, well, you know, and I'm like, Jim, 2 scholarships, 10 years. These guys are running a college, for crying out loud. So it took a while, and they're laughing at me. What was even more funny is I get back to the building, and you know, the finance guy and the actuaries look at us and go, don't you want to make it 12 years? It's like 3 4s, you know, not 10. And I'm like, oh, Jim, Doug, higher math, who knew? So anyway, we came back to the office, an incredible privilege, and we sponsored them. And then I met President Green. And it was a very similar conversation. I'm like, you guys do this every year in addition to running these colleges. So we came back, we met with our foundation leadership and our leadership, and we decided, let's create a 501(c) that is only to support scholarships for Idaho students to go on to an Idaho university or college. We have College of Idaho, we have University of Idaho, and we have Lewis and Clark right now. And it is now set up that it will run in perpetuity. So Doug and Jim and I didn't have to worry about 10 years versus 12 years, but that is what will change the cost of healthcare. Another area of great concern is our shortage of primary care physicians. Idaho is ranked 50th. Well, it goes 47th, 49th, 50th, and for behavioral health, it hits 51. And every year I go, how do we have 51? And one of my research analysts, every time I say it, goes, yeah, well, they're counting Washington, D.C. But anyway, that argument doesn't fly because why are we not counting Puerto Rico? But, you know, whatever. So we met with Tracy Farnsworth at ICOM, and we said, he said, we have a crisis. And we said, I know, because I tried to make an appointment with a primary care physician, and it was March, but I couldn't go in March because I had a conflict. So the next available was December 31st. 10 months. That is not an uncommon story. I hear people talk about it all the time. But to make a difference, we donated $1 million. Actually, Tracy and Farnsworth, the ICOM team and Blue Cross of Idaho created another 501(c). And we put $1.5 million into it, $1 million for scholarships, $500,000 for post-residency payoff of their medical school bills. Every student comes out with about $250,000 to $300,000 in debt. They are not going to work in a rural town in Idaho and pay off $250,000, $300,000 in debt. So ICOM and WWAMI, they're teaching these great students, and we're losing them to across the nation because they have to pay off this debt. So that scholarship, if they stay in a rural community, and they have to commit to it early on in their education, it's not something that they commit, but if they stay there for 5 years, we will pay off that school loan. And the reason 5 years is so important is because research tells us that if they're in that community for 5 years, they will have built roots, they will have started a family, they will feel part of the community. And so when I come knocking on all of your doors to say, can you please help contribute to this 501(c), you will know what I'm talking about, because $1.5 million is not enough. But it was enough to get us started. And so Tracy and I will be pounding the back roads of Idaho looking for help. So let's go back inside. Each day I remind my team that our mission is to make healthcare more affordable. And how do we do that? It's not a small or easy goal, but we believe every single Idahoan is owed affordable healthcare. It is not a privilege to have healthcare. It is absolutely a right to have healthcare. We believe that over the next 5 years, or we believe that total cost of care, the premiums, your deductibles, your coinsurance, your copay, should be 20 to 50% lower. We have been studying it for years, and we have committed the next 5 years to making that happen. It's a hell of a goal, hell of a task. But we believe innovation can get us there. We believe Idaho is the perfect incubator to help us get there, and we can lead the nation if we all work together. Our position in the marketplace tells us we can try new things and then expand them quickly when they work. We are fortunate to have a provider community in Idaho that is as passionate about access to quality health care at affordable prices. It doesn't exist everywhere. Again, 20 states, Idaho's different. But to achieve this, what have we done so far? We launched Blue Cross of Idaho RX plan. We couldn't work with the standard PBMs because profit was what they focused on. What we focused on was access, affordability, and a better experience. We created a payment integrity department because fraud is real, but more importantly, it's also incredibly confusing to bill for healthcare. In 2020, I always forget what year we're on because we kind of lost a year. 2020, they achieved almost $40 million in recouped payments. They're on track to almost double that this year. It's an incredible unit. Our consumer health platform was created for our large group employers because they said every single bell and whistle coming out of Washington or Wall Street is knocking on our door saying that they could save us money. Do they work? Do I need them? So we needed a consumer health platform, a tool that we can run any product through to tell them, one, do you need it with your population? And will it save you money? And if it will, how much? Solutions include predictive analytics. We built one of the first in the nation predictive analytics. We brought the Brookings Institute, we IBM Watson, we have Data Robot. We have a team of scientists that can now tell within 95% of accuracy, not who the 2% is, that everybody talks about the 2% costs the most amount of money, but what's that next generation that's moving up? And how do we partner with the primary care physicians or their specialists to make sure that they never advance to that crisis moment? That is how we can change healthcare. That is how we can change the health of Idaho. Value-based contracts, we pay 70% of all of our contracts are under value-based. Most of them are bonused, and it's not about quantity, and it's not about, it is have your members gone for their primary care physician visit? Have they gotten their mammograms? If they have diabetes, have they gotten their A1C? Have we done what we need to do? Doctors need help. We have one doctor, he has a patient that went to the ER 64 times in a 6-month period. He didn't know. We have to give them the tools, the resources, the analytics to help them, because no one should get between a primary care physician and their patient. But the doctors need the tools, and that's what we provide them. We support multiple lines of business. We know how healthcare works. You know that a 25-year-old does not need the same as a 55-year-old. We have to support all lines of business. Last year, we introduced the Access Plan. And please know it is very tough to work in a highly regulated, legislated industry. We have Congress that believes one product will serve us all. It's not real. It's not reasonable. It makes no sense. The only way to do that is lowest common denominator. We fought with them to really explain that the ACA, although good in theory, doesn't serve all. We are very proud of the fact that we participate with the ACA. We're very proud of the fact that we have been on since day one, and we never walked away when things got tough. But it's not good enough. We had 100,000 people enrolled in an individual plan before ACA. 88,000, where's Pat? He'll correct me, are on the ACA today. We have about 120,000 that are uninsured. So to solve 100 uninsured, we insured 88, and we have 120,000 uninsured and growing. We can do better, and we have to do better. We created the access plans. These are plans for individuals and families that they don't want the ACA, and they are not eligible for any subsidy. It's a very comprehensive plan, and first in the nation, we introduced zero copay for children, because in that same 5 years, I would love it if we stood up here and said, in Idaho, no child will ever be prevented from seeing a doctor because of a copay. That is something aspirational that we can all do together. For employer groups, we targeted networks and clinical solutions to help them. We need greater flexibility. It cannot be managed in Washington. It has to be at the state level. And we have strong leaders in healthcare in the state. And we have very flexible, knowledgeable leaders. Our director of insurance is now president of the National Association of Insurance Carriers. These are people that actually want change. So what else have we done? We have care coordinators that work for the total you. We have care guides that will help you the moment if you're having knee surgery, back surgery, that moment. What's going to happen? What does it feel like? How do I get the help that I need? What do I need at home? It's their job. We have data sharing and innovative analytics for our physicians. We have telehealth benefits. We're going to do everything and anything we can to serve every single individual in Idaho, whether they're our member or not. Let me bring a couple of people to life. We have privacy laws. I can't really tell you about our patients or our members, but let me talk about Medicare patients. Ruth. Ruth, at 47 years old, found out she's going to be a grandmother for the first time. At the same time, Ruth found out she has Huntington's chorea. By the time Ruth was 55, she was in a nursing home. She couldn't talk, she couldn't walk. She would spend her days strapped in a wheelchair and her evenings strapped in a bed. That grandchild at 16 would volunteer at that nursing home so she could hold grandma's hand every single day. You help the family. What is it that they need? At the end, they needed hospice care, and Ruth died peacefully. Ruth's son is now 57. He's in a hospice. He spends his days strapped to a wheelchair. He cannot walk, he cannot talk, he cannot eat. That grandchild that held the hand of Ruth, at 27, perfectly healthy, never had any issues in her life, finds out she's going to have her very first baby. At 27 weeks, she's losing that baby. Rushed into the emergency room and rushed into surgery. Spends the next months in hospital bed rest, and that little baby is born 8 weeks early. That baby's in the NICU. That woman never left the hospital. She slept in the hospital for 8 weeks. I talked about that soldier with the little boy with autism. He's now 7 and doing well because he got into special programs. Care guides help people get into special programs. We find the social services. We do what we need to do so that there's quality of life. 37-year-old boy, spoken as an old woman, boy, 5 years in the Kaiser Integrated Delivery System. Random pains, aches, illnesses, stomach problems, rashes. They don't know what's going on. They test him for everything. They tell him to take Pepto-Bismol every day. He comes here to Idaho, moves here January 1st. In March, he's having the same flare-up. He goes back to the doctor. The doctors of Idaho are amazing. That first visit, that doctor, primary health, found something was wrong. Ran tests, did x-rays, ordered an MRI, rheumatoid arthritis. He should have been diagnosed years earlier. Or how about the executive who is in Manhattan and they say, you don't need to have a mammogram. You know, we're moving to 3 years on this policy. You have no family history. You don't need to get a mammogram. You're good. New York City. Come here to Idaho. The doctor says, let's do a baseline. Cancer. That St. Al's doctor did the baseline, treated at Misty. Incredibly, what an experience. I would not be here today if it wasn't for these Idaho physicians. Bigger is not better. The nation is not stronger. The doctors in Idaho are powerful, smart, their diagnostic skills are phenomenal, and our hospital systems are some of the best. I would not be here today if I didn't get that test. I couldn't share with you about patience. Every one of those people I talked about, that was my family. That was my mother-in-law, my brother-in-law, my daughter, my granddaughter, my son, myself. Healthcare is not a business. Healthcare is not a privilege. Every single one of us has a right to have affordable healthcare. It is not government funded. It is something that we together deliver for each other. And we have some of the best in Idaho. The Blue Cross of Idaho team is committed to fighting. We are relentless. Some of that team is with me here today. I think they are the best in the nation. Did I mention I worked in 20 states? I would take them anywhere because they are mission driven, they are committed to the people of Idaho, they are smart, and by God, we are going to achieve this, and we are not done. They are relentless, and I am relentless. So this is not a business for us. This is personal, and we're here for you. So thank you.
Thank you, Charlene. That was a great presentation. We appreciate your presence here in Idaho and the great things you're doing at Blue Cross. Charlene failed to mention in her list of organizations that Blue Cross had been generous to during the pandemic. She left the Boise Metro Chamber off that list, and we'd like to thank her and Blue Cross of Idaho, as well as the others that stepped up to support the Chamber through that time of crisis. Before we conclude, I'd like to mention several upcoming Chamber events. Startup and Suds featuring Bacon Inc. on June 22nd from 3:30 to 5 p.m. at Twisted District Brewery. August 16th from noon to 1:30, the governor's address to the business community, always a highlight. So we look forward to seeing you there. And then on October 19th from 6 p.m. to 9 p.m. at the Boise Center West will be the Chamber's annual gala. This year's speaker will be Olympic gold medalist Dominique Dawes. So we look forward to those upcoming events. Again, we thank all of our sponsors today. We thank Charlene. We thank Blue Cross of Idaho. And we are hereby adjourned. Thank you.
When I'm on the road, bound for home, back to what I know, back to Idaho, Idaho.